faithfully conveying value, interpreting great books from around the world. Hello, this is Sally's Book Talk. Today, the book we're interpreting for you is The Doctor's Dilemma. The subtitle is about life, death, disease, and medical truths you must know. This is a book written by a doctor. The author, in a plain tone, recounts his thoughts and feelings throughout his medical career, including fear and anxiety before surgeries, guilt and unease after mistakes, regret and frustration after failures, and so on. He even tells of the disasters he personally caused. He is Henry Marsh, a neurosurgeon with over 30 years of medical experience, a senior researcher at the Royal College of Surgeons, and he has been invited as a neurosurgical consultant at several renowned hospitals in the UK. Additionally, the documentary Your Life in Their Hands, featuring Dr. Marsh, won the Emmy Award for Best Documentary. In this book, Dr. Marsh vividly recreates stories from doctors' workplaces like wards and operating tables, allowing you to gain a deeper understanding of the medical profession. Ewan Ferguson, the editor of The Observer, said that in this book, Dr. Marsh candidly reveals the dilemmas of doctors. They are not gods nor all powerful, and it can be called a bloody and magnificent work. Perhaps, in your view, a doctor's main daily work is sitting in the consultation room, doing checkups and prescribing medicines, as serene as a recluse. But Dr. Marsh wants to tell you that for doctors, doing checkups, prescribing medicines, even performing surgeries are not difficult. The real challenge is making choices. So next, I'll take you into the daily routine of a doctor's work to see what emergencies doctors encounter every day and what crucial choices they face. In many emergency situations, doctors have to make quick decisions in a very short time without the luxury of detailed understanding. There's no time to hold meetings, to analyze pros and cons, because only then can they avoid delaying the patient's condition. For example, when an outpatient doctor sees a patient, they must quickly make judgments while understanding the condition, whether they are capable of treating the patient, if the patient's condition can be monitored, or if immediate hospitalization is necessary, and so on. In this book, Dr. Marsh vividly describes a scene from one morning when he was handing over shifts with colleagues. That day, they first discussed an elderly woman admitted to the emergency department the night before. She was found by her daughter, collapsed on the floor at home, and sent to the hospital. During examination, the elderly woman was in a deep coma, unable to speak, and showed no eye-opening response to painful stimuli. Her condition was very serious. After a brain scan, doctors discovered massive subarachnoid hemorrhage in her brain, which could endanger her life at any moment. Dr. Marsh's first question to the attending physician who admitted the patient last night was, "Why did you admit him?" In Dr. Marsh's view, the patient's condition was very severe, and given her age of 72, the department's capabilities definitely couldn't cure her. The best choice at the time was undoubtedly to quickly transfer her to a higher level hospital or to another department capable of treating her. Brain hemorrhage is a disease that requires racing against time. By admitting the patient to his care, this attending physician was likely depriving her of a chance to recover. The physician who made the wrong choice might have moral or conscientious reasons, but compared to the patient's life, these are unimportant. As a doctor, the primary consideration must always be to cure the patient's disease. The second patient was transferred from the oncology department. This patient had melanoma with brain metastases. In the movie If You Are the One to, Sun Hongwei's character had melanoma, which might seem like a common black mole, but when it spreads, it becomes an incurable disease that the world can't handle. Through brain scans, doctors clearly saw that the patient had two large, irregular tumors in the brain. The tumor's location was unusual, making surgical removal impossible. More seriously, Such tumors are often secondary, meaning they have metastasized from elsewhere. This is a sign of advanced stage cancer spread. Even if the brain tumors were removed, it wouldn't help the overall condition much. All the doctors present understood that the appearance of these two tumors meant that death had begun its countdown. In response, one doctor requested to refuse the referral from oncology because he believed our beds must be reserved for patients with a better chance of recovery. Many people feel that doctors doing this might seem evasive and irresponsible, but this is a rational choice made after fully assessing the patient's condition and their own capabilities. In a brief morning case discussion, Dr. Marsh and his colleagues rejected two patients, which might seem somewhat cold and unfeeling. Isn't a doctor's duty to save lives and heal the wounded? Shouldn't they spare no effort in rescuing patients? But with limited medical resources, doctors have to make tough choices. Often, doctors are not saviors, nor are they gods or deities. Dr. Marsh, reflecting on his medical career, said with great helplessness, "Life can be cruel sometimes." I'm sorry, as a neurosurgeon, Dr. Marsh often has to face tumor patients. Even for benign tumors, patients' first reaction is always, is this a terminal illness? How long can I live? It's imaginable how big this psychological blow is for real malignant tumor patients. Once a patient's psychological defenses collapse, often without the tumor doing much, the body will quickly deteriorate. Therefore, when talking with patients, doctors must selectively tell them the truth about their condition. This is another choice doctors face in daily work, requiring strong communication skills. In most cases, doctors have to use their words to comfort and encourage patients, even lying against the truth, to help patients build confidence in fighting the disease. For example, Dr. Marsh wrote in his book that before surgery, he often tells patients a set of standardized words. For instance, the failure rate of this surgery is only 1 to 2%. In fact, Dr. Marsh doesn't know what the actual probability is. It might be 5% or higher. But this way of saying is undoubtedly more appropriate than seriously telling the patient that the failure rate is high. And whether it's a young attending physician or an experienced expert, they must, in such situations, make the patient firmly believe that surgery is the best choice. I am fully capable of performing this surgery well because I am experienced and because, in many cases, the decisions of patients and their families are influenced by what the doctor communicates with them. Dr. Marsh encountered such a case. A patient who fell off a bicycle and suffered severe brain contusion. Before surgery, he told the patient's family, "We must operate on him immediately to remove the damaged brain tissue so that he might survive." The patient's family immediately agreed. Conversely, if Dr. Marsh repeatedly emphasized the surgical risks during communication and told the family that even after surgery, he might not recover to fully self-care and could become disabled, are you willing to let him live like this? Then the family is likely to fall into prolonged hesitation. This is perhaps the choice that, patients' families least want to make. In this situation, Dr. Marsh bluntly told the family that the patient would die without surgery, giving them no choice. Afterwards, Dr. Marsh considered the surgery successful because the patient ultimately left the hospital alive. But years later, when he saw this permanently disabled patient who couldn't speak and had a changed personality, he realized that letting the patient die back then might have been better than the surgery. When encountering similar situations, Dr. Marsh still finds it hard to make choices, which is why many neurosurgeons become more conservative as they age, because they know that performing surgery on a patient, admittedly simple, such blind treatment, while it can save the patient's life, may cause serious trauma. They need to rethink life and death. Additionally, doctors encounter another situation where patients and families are unwilling to give up any hope. The doctors have to pronounce a death sentence on the patient. This is the third major choice doctors face. Patient Helen is a good example. Helen had an ependyma in her brain. Over 10 years, she underwent two major surgeries, multiple rounds of radiotherapy and chemotherapy, but she didn't recover, and her condition recurred repeatedly, even worsening. Moreover, according to the latest brain scan, her life is coming to an end. Helen and her family are very strong and optimistic. When Dr. Marsh learned that Helen wanted surgery again, he wasn't very surprised, but refused her without hesitation. Dr. Marsh believed that such surgery would at most prolong her life by a few weeks, but could bring a series of complications, causing more suffering. Helen and her family couldn't bear it. Dissatisfied with the doctor's decision to take no treatment measures, Helen's family went to another hospital on their own and underwent photodynamic therapy, a treatment with little effect. The outcome is predictable. When Helen was sent back to Dr. Marsh's hospital, the situation had become very bad. Dr. Marsh tried to help Helen and her family find a balance between holding on to hope and accepting reality, but this was clearly difficult because they were still unwilling to accept it. Helen has only a few days left to live, and her family can't even accept the doctor giving her painkillers because this usually means giving up treatment, allowing the patient to suffer less pain before death. The patient's desire to survive doesn't always lead to ideal outcomes and may even cause more suffering. In many cases, doctors have to pronounce a death sentence on the patient because it allows the patient to die with more dignity. However, compared to the difficulty of making choices, doctors also suffer mental torment during their practice. This is the second issue we're discussing today. Foremost is that doctors, in the course of their practice, constantly bear enormous psychological pressure. For example, Dr. Marsh and his obstetrics colleagues once spent 15 consecutive hours saving a pregnant woman with a meningioma. Although it was a benign tumor, the hormones secreted during pregnancy caused it to grow rapidly, compressing the central nervous system. So when Dr. Marsh decided to operate on this pregnant woman, the entire operating room instantly became a battlefield, racing against time. Inside the operating room, neurosurgeons carefully sawed open the patient's skull, gradually separating the optic nerves, only a few millimeters in diameter, and finally removing the tumor on them. During this time, the doctors were highly focused, barely blinking, and had to calmly handle any emergencies. And meanwhile, outside the door, the second team of obstetricians and pediatricians stood ready. As soon as the tumor removal surgery ended, the second team immediately entered the operating room to perform a cesarean section and deliver the baby. All medical staff raced against time throughout, minimizing the impact of anesthesia and surgery side effects on the fetus. Moreover, Dr. Marsh mentioned the duration of surgeries, not to mention the 15-hour one just described. Longer surgeries are commonplace, illustrating the intensity and psychological pressure doctors face. Secondly, as one of the professions closest to death, doctors must always be prepared to face it. Marsh is a neurosurgeon. His patients often have fatal brain tumors, so almost every day he deals with death or dying patients. Since he started at the hospital, he has often been woken up in the early hours, walking through dark corridors to confirm if a patient who had a sudden accident has died. If the patient has died, someone else naturally handles the follow-up work, so the doctor's pain might be less. However, when Dr. Marsh sees patients he treated slowly waiting to die, that kind of pain is truly heartbreaking. When Dr. Marsh was young, he treated a patient by surgically removing an acoustic neuroma from his brain. Afterwards, due to postoperative complications, the patient never regained consciousness. becoming comatose, confined to a hospital bed, sustained only by various life support systems. During each ward round, Dr. Marsh would see this patient lying with eyes open and expressionless, unable to speak or move. The patient's mother visited him at a fixed time daily, bathing him, trimming his nails, but more often just sitting motionless by the bed, watching her son. Behind the elderly woman's rigid expression lay deep heartbreak and helplessness at losing all hope in life. The patient wouldn't improve from his mother's meticulous care. Instead, she could only watch him waste away until life's last spark vanished before her eyes. Like a virus, this scene spread through every witness, creating profound shock deep within each person. Beyond these uncontrollable factors, accidents during treatment also cause psychological torment for doctors, often more intense, because these harms could be said to be caused by the doctor's own hands. This too was something Dr. Marsh experienced personally in his youth. While removing the final tumor fragment during surgery, Dr. Marsh accidentally nicked the patient's basilar artery, causing massive hemorrhage that left a vibrant young man who'd been chatting with him days before in a permanent coma. For the equally young Dr. Marsh, this was undoubtedly a massive shock. As he himself admitted, even decades later, he still avoids discussing the inner agony he felt witnessing it all. Years later, Dr. Marsh encountered this patient at another nursing home but failed to recognize him. She saw a gaunt figure, incontinent, bedridden for so long that his health had been catastrophically ravaged. After this incident, Dr. Marsh nearly lost all confidence to continue performing surgeries. When encountering similar cases, he'd subconsciously deem these tumors inoperable or refer patients to other hospitals. Fortunately, he didn't remain defeated, but gradually regained courage, eventually becoming an expert in neurosurgical oncology. Dr. Marsh writes emotionally in his book, "Every doctor has a cemetery in their heart. My task is to make the next surgery as perfect as possible, not add another tombstone to that cemetery." There's another psychological torment that non-medical people may not comprehend: the pain of facing illness in loved ones. Dr. Marsh experienced this when his son was 3 months old, receiving a call from his wife saying their son was critically ill with possible brain issues. After learning the news, he sped to the hospital late at night, his mind filled with deep anxiety, barely considering anything else. He even ran over a cat darting across the road. According to Dr. Marsh, he and his wife lived in a bizarre world those days, with worry and fear being the only real sensations. A fear mixed with profound helplessness. This is likely why most doctors avoid operating on their own relatives. At this point, Dr. Marsh has depicted his daily work reality. Being a doctor means wrestling life from death's grasp, constantly facing irreversible life or death decisions. Yes, with every choice and every rescue attempt, doctors shoulder enormous psychological pressure. When the worst outcome occurs, a single word from the patient's family can transform a doctor's world from hell to heaven. So, how should people view the medical profession and how interact with doctors during treatment? Dr. Marsh records an unexpected incident in his book involving a pituitary tumor patient he treated. Pituitary tumor removal is considered relatively minor in neurosurgery, but since the pituitary sits at the brain's base, surgery risks damaging vital adjacent blood vessels. During pre-surgery communication, the patient's wife and 3 daughters proved exceptionally understanding, making for a pleasant discussion. The surgery proceeded extremely smoothly, with the patient's symptoms improving as expected post-operation. Unexpectedly, just as the patient was about to be discharged, he suddenly developed cerebral infarction, one of the common complications of this surgery. While doctors performed emergency treatment and assured the family there was no life-threatening danger, the patient developed brain herniation, a fatal condition rendering all rescue efforts futile. When Dr. Marsh had to announce this tragic news, the family fell silent. He even felt they deeply hated him, believing he had killed their loved one. But unexpectedly, the patient's wife told Dr. Marsh that before entering the operating room, her husband had urged them to trust the doctors. He handles the treatment and we handle the trust. Therefore, after such tragedy, they didn't blame the doctors because even then, they still believed the doctors had done their best. The wife's only request at farewell was, "Please remember my husband. When you pray in church, think of him occasionally." This wasn't Dr. Marsh's only deceased patient, but the most unforgettable. Undoubtedly, the death was surgery related. Technically, though, it wasn't his surgical error. He didn't know why the infection occurred, nor could prevent it. Yet, if the family pursued it, as lead surgeon, Marsh had no defense and would shoulder significant responsibility. But the family's trust and forgiveness made him feel like crossing from hell to heaven. To him, it was like someone handing him a warm cup of coffee on a freezing night. For doctors, as long as they gain patients' trust and understanding, no hardship or pressure is too great. The line from the book, "Trust me, everything will be all right." Dr. Marsh said this to patients' families and to himself. In the book's opening, Dr. Marsh wrote, "I have saved lives and caused deaths," the most fitting summary of this work. A simple sentence embodying complex emotions. Doctors save lives, yet are human and fallible. Between hero and eternal sinner often lies but a single step. All right, that concludes our interpretation of The Doctor's Dilemma for you. The reading notes are below the audio. We'll see you tomorrow.